Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid, brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
You've identified a possible neck or spinal injury. The patient has cervical neck pain. They don't want to move. Everyone is looking at the collar. But here's the question. Is the collar the most important part of spinal care? The answer is no. The person holding the head is. This episode, we're looking at the application of a soft cervical collar. Before the collar is even applied, remember the priorities in spinal management. D, dangers. Ensure the scene is safe. Manage the airway, breathing, circulation, and then return the head to neutral position if possible, using manual traction using your hands. But never force movement. If resistance is felt, pain increases, or the patient cannot tolerate the movement, stop immediately. One first aid responder should maintain manual support of the patient's head throughout the entire procedure. This person becomes the team leader for any movement and coordinates every action. If the patient needs to move, the head moves first and the body follows. Before applying a collar, prepare the patient. Explain exactly what you're doing. Remove bulky clothing, necklaces, jewelry around the neck. If the patient is already laying down, gently position the head in neutral alignment if tolerated. In adults, slightly elevate the head approximately 2 to 5 centimeters. This may help achieve neutral position, often bringing the head in line with the mid-clavicle. Next comes sizing of your cervical collar. A collar that is too small provides poor support. A collar that is too large may force the neck into an uncomfortable position. Most soft collars are available in extra small, medium and larger sizes. Measure the distance between the top of the shoulder and the bottom of the chin. Many first aiders use their fingers in a C or a V shape as a quick measuring guide. Then measure this against the cervical collar. Once the right size has been selected, the collar should extend from the sternal notch to the underside of the chin. Now, the application. While one first aid responder maintains manual support of the head, slide the rear Velcro strap under the patient's neck. Bring the front section around the neck. The chin should rest comfortably where the contoured chin support is. The center marking, often labeled with C-spine not clear, should sit in the midline. Now, secure the Velcro. After application, reassess the patient. Is the cervical collar comfortable? Can they breathe and swallow comfortably? Are they trying to remove it? If the patient becomes distressed or attempts to pull the collar off, slightly loosen it. It might improve comfort. Remember, the purpose of the collar is to remind the patient to minimize movement, not to force immobilization. For larger patients, the ends of the collar might not necessarily meet completely. A small gap may be acceptable. However, if the gap exceeds approximately 4 centimeters, the collar is likely the wrong size. For smaller patient, the ends may overlap. That's acceptable if the patient remains comfortable and the collar fits appropriately. Once the collar is in place, continue to encourage the patient not to move their head. If other injuries permit, the patient may be managed laying flat and with the head and body aligned. Support the head whenever lowering the patient onto a stretcher or the ground. And remember, the collar is only one part of spinal care. Manual support, careful movement, reassurance, patient comfort. The ongoing assessment remains far more important than the device itself. Because remember, collars don't protect the spinal cord. Good, holistic patient management does.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.
Welcome to your Daily Minute.